So you can see
Washington University and St. Louis students are having a real eye-opening experience.
One of the things that stuck with me was all of the different things that can go wrong in pregnancy, but the fact that maternal mortality is just increasing, especially in the US, I just think that's such a shocking fact that people are not quite thinking about or not realizing how incredible that is, especially in this country where we're supposed to have the resources and the technology.
They completed a recently launched innovative course at the McKelvey School of Engineering.
the name of the course is Women's Health Engineering.
The class is about 85% women. I know all the men in the class, and all of us have enjoyed it. The appeal for me is that it's a very understudied topic. There's a lot of funding available, and there's a lot of research to be done. And I think too often in engineering, we feel like the field has all been explored, and the only things left are things that are super complicated and above our heads. But when you find an area that hasn't been explored nearly as much as it should have been, there's just too many opportunities.
There is growing research and technology in this area of engineering, giving rise to what's called FemTech.
So FemTech is the sort of generic name that's been given for a lot of startup companies in the space of women's health, really focused on technology. So anytime you're talking about engineers in this space, as opposed to just general medical research, we're focused really on engineering. So we're focused on bringing engineering tools and techniques. So that's a relatively new type of ultrasound. So historically, ultrasound machines were on big carts, and so they would roll it into a room. But now it's just a transducer and an iPad or another tablet. You can even get the transducer to talk to your phone. There are places in rural America where there isn't maternal care anymore, where hospitals have been closing their obstetrics units. So the ability to miniaturize engineering technology like an ultrasound machine and bring it out into the field.
Michelle Oyen is an associate professor in biomedical engineering and the director for the Center of Women's Health Engineering.
We've been in existence for about a year and a half. The center has 4 pillars of what we're trying to do. We have a focus on research, so developing relationships between people in engineering and people at the medical school with a goal towards advancing women's health. We have a teaching component, for which this class that we've started this year is part of that, so a new course on women's health and engineering. And then we also have an element of entrepreneurship, working with founders in the FemTech industry.
She explains women's health has always been underfunded.
Well, anything to do with women's health has been historically underfunded and understudied compared with conditions in men's health. And that just comes from the history of research didn't used to be done as much by women, and women tend to be more interested in problems in women's health. So the great thing that's happening right now is that there's an injection of financing into research. There's a big women's health initiative that's being led by the White House right now. There's a lot of development work.
Biomedical engineering student Tisa Mandel explains how the course and the needs in women's health are more than just about reproductive health.
Mental health and like cardiac health and also like bone health, and it affects like all organs and body systems.
Example being cardiovascular disease. If your mother has preeclampsia while she's pregnant with you, whether you're male or female, you can have cardiovascular disease later in life as a direct result of that. So these effects are multi-generational. And so even though we talk about women's health, it's really just human health.
Oyen says there are many opportunities for jobs and innovation in FemTech.
Solutions that will have true positive impact on the world.
Prior to this, I was interested only in orthopedic surgery, and now I am starting to get a little bit more interested in obstetrician, gynecology, and also like oncology, because we talk a lot about cancer.
So it's a set of diseases that get lumped all together because they are